What if psychedelics are more like surgery than therapy? And what if a skilled practitioner with the right tools could help heal mental wounds that have remained open for years? Welcome back to the Psychedelic Podcast, and this is your host, Paul F. Austin. Today, I am joined by Dr. Tracy Townsend, a Harvard-trained orthopedic surgeon who left her scalpel behind to become a legal, licensed psilocybin facilitator in the state of Oregon. Tracy shares fascinating insights from the front lines of legal psilocybin work, drawing powerful parallels between physical surgery and what she calls mind surgery with psychedelics. She explains how her medical background informs her approach to working with clients, including those on psychiatric medications who are seeking alternatives. We also explore the emerging evidence for psychedelics in treating physical conditions from allergies to autoimmune disorders, revealing the profound connections between emotional healing and physical well-being. All right, that's it for now. Let's get into my conversation with Dr. Tracy Townsend. Tracy, welcome to the podcast. It's great to have you join us.
Thank you for inviting me. I'm happy to be here.
So you're like this rare breed, you know. You're trained at Harvard. You're trained in pediatric orthopedics, which as a surgeon, which is fascinating. You are now actively and legally guiding psilocybin experiences in Oregon. Just to put two and two together, anyone who gives up orthopedic surgeon or surgery for guiding psychedelic experiences is clearly incentivized and driven by things beyond just making money. So I just want to draw that comparison. And I first found out about your work, I believe, through X, formerly called Twitter. You've been quite involved, and you have some really great perspectives that you share there. And where I'd love to start with guests is just hearing a little bit more about your background. So what was it that had you shift from surgery, pediatric orthopedic surgery, into a psychedelic plant medicine integrative medicine path?
I get this question a lot because I think it seems like I don't come from a mental health, therapy background or anything like that. It seems like a 180, but for me, it all makes sense when you consider, well, let me back up. One of my early passions, it was and is preventative health, because an ounce of prevention is worth a pound of cure. And I would say that as I went through medical school, I was sort of like a helper, wanted to go into medicine from a young age. And then when I got into medical school, I always say that's when my eyes were sort of first open to what the modern practice of medicine actually looks like and what it entails within the construct of Western allopathic medicine, the conventional kind of default medicine that we practice here in the United States today. And when I saw, what the practice of medicine was like, while I was interested in all areas of medicine, I was fascinated by neurology and psychiatry and women's health and all of that. While I was in medical school, I always say, like, if I just got assigned a specialty, I would have made it my love and passion and, tried to excel at it. But I was drawn to the surgical specialties early on, I think mostly because I was really influenced by various writers, and I loved the ritual of it, honestly, which makes sense now when you look at how I practice with psychedelic medicine facilitation now, where there is such an emphasis on ritual and ceremony and the importance of that. I really loved the immediate gratification that's available with surgical intervention, and I liken psilocybin facilitation to mind surgery all the time. I think it's more like a surgical intervention than it is a therapy. It's instantly gratifying when you work with people in this capacity, and so people will have not only rapid relief but sustained relief from all sorts of symptoms that they were afflicted with for years. I mean, my most recent client is in his early 70s, never had a psychedelic experience before, struggled with lifelong anxiety and depression, very high functioning, and said to me that his experience right after the ceremony and the day after, and now I just checked with him, he's about a month out, but he said that that was the first time in his life that he had experienced a depression anxiety-free day in his adult life. And so it's instantly gratifying. Psychedelics were not a thing when I started medical school. I mean, I received no training about it, no education about it. It wasn't until I was in residency on the West Coast in Los Angeles where if you sneeze, you'll find someone who can get you some psychedelics. And I crossed paths with people, mutual friends of ours who introduced me to the intentional and ceremonial therapeutic use of plant medicines. And this was right at the beginning of my surgery training. And I just had the most incredible transformative experiences of my life. And it was honestly, like a deep, deep relief like that there was more to reality than what my little mind at the time had constructed. And so it was paradigm shifting for me right at the time when I was really deepening my philosophy about what health and healing and death and dying really is about. And it was in 2018 when Michael Pollan published How to Change Your Mind. I mean, boom, psychedelics go mainstream. It feels like overnight, and it's everywhere. And that was right when I was in the middle of my residency training. And so I definitely went through an existential, sort of professional existential crisis because I was thinking, I had become a full-blown psych and not as fascinated by consciousness and how it influences the physical manifestation of reality, including our own bodies, and how it influences how our minds influence our biology. And also seeing the profound limitations of how we treat mental health conditions and how it impacts people's ability to just be healthy through lifestyle and behavioral changes, which is the majority of what our healthcare system is burdened with today, is chronic diseases based on lifestyle. So I just kept following the research and finding my own way to sort of integrate it into, how I was seeing patients who present with musculoskeletal conditions, which, by the way, the majority of which have their basis in our psychology and also intergenerational and childhood trauma, adverse childhood experiences, that sort of thing. I didn't really see a path like kind of going forward at the time there to practice with psychedelic medicines, although I could see with the research that it was starting to go mainstream. And then I say a lot of this is like fate-driven and serendipitous or synchronous, however you want to think of it. But it was in my final year of training when I was up in Boston that Oregon passed Measure 109, legalizing the adult use of psilocybin. So it was the first of its kind in the U.S. legalizing psychedelic medicine. And so I was looking for a job at the time. It was the middle of COVID, it's 2020. There weren't a whole lot of jobs opening up for pediatric orthopedic surgeons. No one wanted to hire into their group when no one was doing surgery. But as luck would have it, a position opened up in Portland. And I was like, well, that's amazing. Oregon's going to be the capital of psychedelic medicines for the next few years. So interviewed and got the job. And I thought I'd be practicing for a few years before I'd make the shift. But Intertrek opened up their facilitatory training program. Our friend Charles, always nudging me along in this direction, sent me the website to be like, hey, have you seen this? And so I wouldn't have seen it if it weren't for him. Oh. So I applied and got in. And then as soon as I was doing the training, I was practicing pediatric orthopedics at the time. I just felt my heart totally pulling me into the space. I was meeting people who are working in the space. Every spare moment I had was learning about more and more about psilocybin facilitation. And I ended up hiring a coach, my friend, who's like a personal transformation coach, and worked with her for 6 months because I was coming up on my board certification, the final step. becoming a board certified orthopedic surgeon. I had done the horrendous 8-hour written exam and passed that, and all I had to do was this oral part of the boards. But it was amazing. I almost like couldn't even bring myself to do the paperwork that was necessary for that final step. And it was like my body and everything was telling me like, no, you don't want to take this final step. You want to actually fully step into psilocybin facilitation and be a part of this broader psychedelic movement. And it really was sort of answering a call that felt like, what is my unique path in this lifetime to contribute? And I felt like the ways that I can contribute in this movement compared to my contributions that I would have made as a pediatric orthopedic surgeon, all of it was sort of like following my passion and following my heart. So I ended up resigning from my job way sooner than I thought I would and starting my own psilocybin facilitation practice. And then we're a couple of years into that, and I ended up merging the practice with a local service center here. And my day-to-day job now looks pretty different, although there are a lot of overlapping elements.
So something that you've refined is what you call the portal process. And I want to talk about some of the particulars of that, especially from your background as an MD and maybe even these parallels between facilitation and an orthopedic surgeon. But I want to take a bit of a broader step back, because you're really the first guest that we've had on the podcast that is a licensed psilocybin facilitator in the state of Oregon. And so psilocybin has now been legal for just over 2 years. The like you said, the measure was passed in the November 2020 election, but it was implemented and legal at the beginning of 2023. So it's just been over a couple of years now. And it sounds like you've been involved for much of that time. And I'm just curious to hear your reflections and thoughts on what is it like to be a legal psilocybin facilitator in Oregon? What is it that you love about it, maybe besides the obvious fact that it's legal, and that I would imagine, were you board certified at this point in time, or did you not? Or did you sort of, and I guess I'm curious about that as well. Like, as an MD, can you be board certified, or can you actively practice with a Schedule I substance according to the FDA? How do you sort of navigate that space with legal psilocybin in Oregon?
Yeah, that's a great question, because I do think there are a lot of physicians who are interested in psychedelic medicines, but because they're right now Schedule I, it's technically illegal at the federal level. So I operate in this sort of gray area here within the state of Oregon. The Oregon Medical Board seems to be fine with me holding my state medical license as an MD and working as a general practitioner, and then also holding the state license as a psilocybin facilitator. There definitely were a lot of questions and concerns about that from people who are dual licensed providers. So there's a lot of therapists and psychiatrists, all sorts of people who carry, licenses by other governing bodies. And there's actually a move now. I'm actually getting more involved with it from sort of a local government and advocacy standpoint to create a special licensing category for dual license holders. It was interesting. Like, I think it might be interesting to go back and tell the story of when I was actually looking to make my transition. It wasn't clear what my path was going to be like. So I did sort of come out of the closet, the psychedelic closet, to my colleagues. I was working for Kaiser Northwest Permanente at the time, and let them know, like, hey, I am just enrolling in this education program, not facilitating. I'm not, engaging in anything that's technically illegal yet. But I'm really passionate about this medicine. This medicine has really helped me to heal, and I believe it's going to change everything in medicine. And I am really passionate about it, and I'd like to pursue this. And there was definitely concern from the heads of my department about the fact that it was Schedule I, and everyone's ultra conservative there, and they're saying like, hey, I don't know if you can hold your DEA license where you're prescribing pain medications, that sort of thing, and be doing this. And so that's when it, sort of the rubber was really hitting the road, where I was really having to make a decision here. Because I was in my idyllic mind, I was thinking, oh, I'll go part-time with pediatric orthopedic surgery, and then I'll do psilocybin facilitation part-time and kind of be able to have the best of both worlds. But that it was becoming clear that I wasn't going to be able to do that. And so I really did have to make a choice to let my position within, conventional medicine go. And I honestly didn't love prescribing the medicines that the DEA license allowed me to prescribe. I was, again, growing more and more passionate and wanting to explore what this other medicine, what psilocybin can do. But that's sort of part of the reason why I ended up having to make kind of this more concrete shift out of pediatric orthopedics and into psilocybin facilitation. But I do still hold, both licenses. I think there's a lot of misconception out there that you have to give up your medical license in order to do this. You don't. I operate under the adult use model within Oregon for psilocybin, meaning it's not medicalized. So there's different levels of legality. There's, baseline decriminalization efforts. That just makes you lowest priority for law enforcement. And then there's, I would say Oregon's model sort of a step above that, where it's legal for any adult over the age of 21 to use psilocybin for any reason at all. You don't need a diagnosis or a referral or anything like that. And then there's medicalization, where you have to go through a medical provider, and it's like a prescription model. So I actually engage with clients in a client-facilitator relationship, not a doctor-patient relationship. So legally, that's the relationship. So I call myself a vitality coach. I'm actually coaching you to access more vitality in your life, and help people to, a lot of the model here, we talk about awakening the healer within, is that you're actually not coming to me for me to diagnose you with some issue and then prescribe you whatever I think is going to be best for you. Most people actually deep down, they're going to know better than anyone what they need. It's more just about accessing that and revealing that to themselves, and also leveraging the neuroplasticity that's available with psychedelics to actually create actionable change in their lives. And so, that's a little bit of how legally I practice as a licensed psilocybin facilitator. And I don't have a medical practice. It's actually more akin to a health coaching practice. And I love it. It gives me so much more freedom. There's so many less regulatory, but as much as there are regulatory requirements that we have to meet, it's a lot more freedom than we have in the conventional healthcare system. And I just love working in a licensed service center. It's this beautiful third space. It provides a lot of safety to both clients and facilitators to be in a third space like that. I love the precision dosing. So many people are like, oh, I took mushrooms and they didn't really do anything for me. And I always say or conversely, you overdo it and you go way deeper than you anticipated. And I always say that I love the fact that we know exactly how much psilocybin analyte we're working with, how potent the mushrooms are, where they were grown, who they were grown by. And
can you lemon tech mushrooms or make a tea out of the mushrooms, or do you have to serve the mushrooms just sort of raw, grounded up? Kind of what's that process?
There's actually some gray area within the regulations. Some readings are that you can't lemon tech. This is getting really behind the scenes here in Oregon. Some readings of the rules are you can't lemon tech. Other readings of the rules are you can lemon tech, but only with packaged products. You're not allowed to have fresh fruit, juice squeezed from a fresh lemon, but you can from one of those lemon concentrates. The mushrooms are from the cultivators, the growers. They come in either the whole fruit, or you can get them powdered or homogenized, and you can make a tea out of the powdered version, which is nice for some people just to help with the digestion. And it's a little bit, the thought is there's some quicker onset of action there. Yeah, what else do you have?
Well,
Yeah.
this is interesting. One other question that's coming up is like, as a facilitator, a legally licensed psilocybin facilitator, you are not providing, as you've mentioned, medical advice. You are a health coach within this system, and yet you're still an MD. You've still been trained to be an MD. Um, you are quite intelligent and probably one of the few Harvard trained MDs who is a legal psilocybin facilitator. You might be the only one for that matter. And so my question would be, just, you've been involved in this for some time now. What changes would you like to see made as part of the facilitation and how this is done legally so you can do your job better than how you currently are doing your job? What do you think are restrictions? What do you think is unnecessary bureaucracy? What do you think are certain conservative limits that have been put on it that are not necessary? I'd be curious to hear your reflections, like how, now that you've been sort of walking the territory for some time, what areas are there for improvement inside the system?
Oh, I love this question. And I hope our Oregon legislators
We'll
within
share
the
this
Oregon Health.
podcast with them. I'll send it to
Yeah,
Sam
Oregon.
Chapman and he can put it in their desk.
Exactly. We'll send it to Oregon Psilocybin Services and the Oregon Health Authority. Yes, the rules. I mean, there are hundreds and hundreds of tiny fine print rules and it does make you laugh about some of the, whoever drafted these rules. And there are many conversations about it before they're finalized. And yeah, I mean, so many come to mind. I don't even know if I can order them in terms of priority, but I'll just start naming a few. One is, there is a 50 milligram psilocybin analyte limit. That's the biggest, that's the largest dose that we can give. So 50 milligrams of psilocybin analyte is, roughly, depending on the strain of mushroom, anywhere around 10 grams at the most, which is, most people say like, oh, that's a huge dose. But for folks who have been taking psychiatric medications, but specifically the blunting medications like antidepressants for a long time, or maybe are still on those medications, it can be hard to overcome those blunting or diminishing effects of those medications for those people. And so it would be nice to have the option to go higher. And sometimes I've seen people who, because of that limitation, they'll, say wean off of their antidepressant and everything for a few weeks, and then they'll have their psilocybin experience and then not really have much of an experience at all, even at the highest dose. So then they're turning to the underground where you have freedom to take, a higher dose. And as we know with psilocybin-containing mushrooms, there is no lethal dose. They're incredibly safe in that way. So you can go so much higher. So the limitation is not really based on safety from that perspective. The other thing, too, is there's limits on microdosing. So because all of the mushrooms have to be taken at a licensed service center and under the supervision of a licensed facilitator, and there were minimum time limits for a particular dose for however long the session needs to be, it makes it basically impossible to be able to microdose under the current regulatory framework that we have. And there's so many people who are interested in microdosing. And I think there is a way to get creative and still have it under the purview of a licensed psilocybin facilitator and through the licensed growers and the centers and whatnot, maybe have an education process, but then maybe allow people to be able to take the microdoses at home and take them, as scheduled. There are limitations on how late the sessions can go in the licensed service center. So all sessions have to end by midnight. And as you know, if we look at indigenous, lineages who teach us about, there are these wonderful liminal states that can be accessed throughout the night. So if someone wanted to create a setting that's a little bit more informed by indigenous contexts, you can under the current framework, even if you have a transportation plan in place. That's another thing. You're not allowed to spend the night at the service center. So a lot of the service centers, including the one that I have and operate out of, it's a converted craftsman home. It's a beautiful space. It'd be wonderful to not have to navigate yourself out of the space after. If you when you go to a retreat center or you're in an underground setting, a lot of the times you just sleep where the journey took place. And it's
For sure.
wonderful to be able to do that. And I think there's a safe way to do that in the same way we would say if we were taking care of you as an inpatient or something like that. And so I wish that the regulations could be updated to allow for that. Um, I could go on.
You could. I like this. We'll make a whole list from Tracy Townsend and
From
send it
my
over
lips to their ears.
to
Yes.
the OHA. So thank you. Those are some great reflections. I know specific to microdosing through the nonprofit that I helped to start, the Microdosing Collective, we've been advocating for, to reduce the time limit, I think from 3 hours to 30 minutes or something like that in terms of how long someone has to stick around. The ideal would be to open up some sort of facilitator license model where you as a legal licensed facilitator could provide microdoses to a client and they would microdose under your guidance virtually. That I think is what we're aiming for, and I think would be a great model to handle, but we are not there yet. Now it's interesting how we're sort of picking these aspects apart because you've mentioned SSRIs, right? You've mentioned that people who are actively interested in working with psychedelic mushrooms, many of them are interested because they're depressed or they've had a history of depression or they have a history of anxiety or PTSD and they've been on different psychiatric medications. And the clinical research, from what I've understood, is, I would say, unclear. I've had some close friends of mine, including faculty in our training program, who are psychiatrists, who say you should not take psilocybin if you are on an SSRI, especially a high dose, because there could be risk of serotonin syndrome. And I know of plenty of other, medical professionals or doctors who say it's no problem. I do it all the time. And my question is not so much like, is that true or not? My question is more specific. You've mentioned already that you are not providing medical advice as a licensed psilocybin facilitator, and yet you would need to do a medical intake on these individuals who are on psychiatric medications to make sure that it's safe. I mean, just as a very clear-cut example, if someone is on lithium, they should not be doing any psychedelics whatsoever. So how do you approach that space? If you have a client who's coming in, they've been or are currently on psychiatric medications, do you then have a conversation with their GP or their psychiatrist? Do you just say, hey, we're just going to move forward with it anyway? Kind of what are you doing from an intake perspective if you have someone who comes in with a clinical condition and it's pretty clear that they're coming in to help with their depression or anxiety or PTSD or whatever it might be?
Yeah, so and I think this is standard of care, for licensed psilocybin facilitators here in Oregon, but everyone comes in and goes through the initial screening. There's just a very basic screening. That's handed down by the Oregon Health Authority with screening questions like, have you taken lithium in the last 30 days? Are you experiencing suicidal ideation? Do you have a first degree relative with schizophrenia? That sort of thing. So safety is, of course, number one. And then beyond that, we take all of our clients through a very extensive health intake that is like a 360-degree evaluation for physical and mental health and family history and that sort of thing. Definitely the question of psychiatric medications. I mean, other medications too. I mean, people come in with various cardiac conditions,
Sure.
atrial fibrillation, that sort of thing. So I do feel like we are in a position to help a subset of clientele that maybe would be turned away from other facilitators just because we have a little bit higher degree of comfort with that, or at least I do, with navigating those sorts of things. But when it comes to the psychiatric medications, there definitely is an optimization conversation that we have. And so, everyone's situation is different, but it is I think it's within the purview of being a licensed psilocybin facilitator. If you've done extra education, it's not necessarily in the curriculum, the baseline curriculum, but if you've done continuing education on risk stratification, that sort of thing, you can provide education to clients, I do, on how to optimize themselves from a medication standpoint. And so it really is just about informed consent. If you're going to be spending the time, energy, and money on this experience, well, especially for a particular outcome, which is relief of your anxiety or depression symptoms, well, you're going to want to know like what's the most optimal way to go into that. And I always use the metaphor of going into surgery. If you're doing an elective orthopedic surgery for yourself, maybe you sustained an injury. I think most people actually sustained a mental injury. They don't have a mental disease. And that, it's like, okay, well, you want to do this elective intervention for it. Great. Well, let's optimize you for it. So in the same way that I would not reconstruct your ACL right away if you're kind of in the throes of an acute crisis, or maybe you're smoking, 20 packs a day or something like that of cigarettes, like that's not optimal for your surgical outcome. So I'm going to try to optimize you for surgery beforehand. If your hemoglobin A1C is too high, we're going to try to coach you to, bring that down, that sort of thing, especially if it's for an elective intervention. And so same way for going into a psilocybin experience, you don't want to be in acute crisis. You want to, hopefully have been through an acute crisis. Maybe you're put on medications to get through your acute crisis, or maybe you've been on them for years and they're just not working anymore because they were never designed to be taken chronically. And so it's just a conversation of, well, have you considered tapering or weaning off? Yes or no? Are you in a position to do that, looking at your, life circumstances? I do have that conversation a lot. Actually, to address the question about serotonin syndrome, in practice, we just don't see it. And so we do give psilocybin to people who are on SSRIs or SNRIs, and it's not an issue. We just don't see it. It's more of a theoretical concern. That being said, I think it's not optimal, and that's also, we haven't even gotten into benzodiazepines and sleep medications like Ambien and that sort of thing. But I do have the conversation with people that you're stepping onto a fundamentally different path when you're starting to consider working with psychedelics. That's different than the model that is under with pharmaceuticals. And so the idea is that you're ready to go from maybe passive coping by taking this medication every day to active coping, where you undergo 1 or 2 sessions and you're ready to take the neuroplasticity that's available to you to actually implement the changes that help you to overcome the depression and the anxiety, and shake free from where you've been stuck before. And so I let people know that, hey, a lot of these medications are meant to sort of numb or suppress emotionality. And the whole point of a psychedelic journey is to increase emotionality, to access that and to leverage that experience for creating sustained change in your life. So it's kind of like trying to go diving while wearing a life jacket. It's like you're kind of fighting yourself if you're continuing the medications while going into the experience. And honestly, I've started to work less and less with people who haven't started to wean or titrate down off of their medications with the provider who's prescribing it to them. And so I really encourage people who are considering working with psychedelics or psilocybin in particular to start that process and give yourself plenty of time to do it.
Yeah, I just want to reflect on this metaphor that you brought up, which is the parallel between physical surgery and the sort of mental surgery that psychedelics provide. I think that's it's a point that I haven't heard before. I think it's a really salient point and a really profound point, that this is not mental illness necessarily, although there can be mental illness. But in most cases, it's more mental injury, and that wound has never had the space and time to heal. And so if going into that, and if looking at psychedelics as sort of a scalpel for surgery, then doing the necessary prep work to ensure that is as optimal as possible, I think it's a profound insight and reflection. I think that's a really strong teaching. So we know psychedelics are useful for depression, addiction, anxiety, and we also are having some emergent research coming out around autoimmune conditions. And you've talked about this a little bit. I know it's not necessarily your particular specialty, but I think as an integrative physician and as someone who has worked within the medical industry and is now doing psilocybin work, I also trust that you're familiar enough with some of the mechanisms of action or some of the stuff of what's going on. Why is it that you believe psychedelics could be a really effective intervention for autoimmune conditions? What might be happening there, and why might they be useful for folks who have autoimmune conditions and maybe other interventions haven't been all that useful for them?
Yeah, autoimmune conditions are very poorly understood within, within with the allopathic lens, which, in my opinion, focuses way too much on the physical and the sort of biochemical or biomedical lens, and fails to adequately integrate, hence integrative, physicians, or the integrative lens. Biopsychosocial, and dare I say spiritual factors that play a role in the manifestation of disease. And so, if we trace back Western medicine all the way back to ancient Greece, if you had some illness you were afflicted with, or you're manifesting some sort of symptoms, which in autoimmune conditions is your body attacking itself, its own tissue, basically, and identifying your own cells and tissues as foreign, and therefore attacking it. And so if you were to go to a physician in ancient Greece, they wouldn't laser focus on the physical manifestations. They would be asking you about the psychospiritual roots of your condition and going into the emotional layers and all of that. And
Which is much more shamanic in some ways, right? Like not purely shamanic. Shamanic, I think, is somewhat just purely the spiritual aspect, but there is a deeper layer there that they're going into.
yeah, it's just acknowledging the mind-body connection, and realizing that we aren't just like this floating head and the rest of our body. It's just that it's so intimately connected through our hormonal and endocrine system, and in our immune system. And so, it's trusting that if you were to approach the problem, the condition, from that lens and start to do some of that work, that the physical healing would follow. And so when it comes to any chronic condition, not just autoimmune conditions, but any chronic disease, whether it's gut conditions or skin conditions or cancer or diabetes, obesity, all of it. It's really interesting to see when people start to do the work with psychedelics that really get to really deep psychological wounds, what happens at the physical level. For example, sort of allergies are not really, they're sort of tangentially, related to immune conditions. And there, one of the clients that I worked with, he had a severe fruit allergy, and he ended up having this is a middle-aged guy, and he had a profound experience on psilocybin where he was healing the abandonment that he felt as an 18-month-old when his mother got into a car accident and sustained a traumatic brain injury, and that severed her ability to form short-term memories. When he was 18 months old, that's his mother. And so he was actually raised by his grandmother. His mother was around, but he didn't really have a relationship with her. And he didn't realize that he had internalized this as rejection or abandonment is really just at the core a mother wound, a really deep mother wound that he wasn't even conscious was affecting him. He's a very high functioning small business owner, sort of patriarch of his family. And he grieved his entire journey and was weeping. And also for him, I was channeling like divine mother energy for him. And he was having all these realizations. Well, after his experience, he goes back home and he feels very intuitively drawn to having some fresh fruit, and his family freaked out because they're like, no, what are you doing? You're allergic to that. And he ate it anyway. He tried some anyway, and he did not have an allergic reaction. It's so fascinating. Like, I find that incredibly fascinating. It's anecdotal, of course. This is not, double blind, randomized control, placebo controlled trial. Like, that should cause anyone who has an interest in healing, like in health, just to stop and get insanely curious by that and ask why and what's the mechanism of that. And that's just one of several examples, I feel like, of people having really tangible physical manifestations of their healing.
The best story that I've know about in regards to that is Andrew Weil has told his story many times, the integrative medicine physician who we've had on the podcast a couple years ago. And he talks about how during an LSD experience, I believe it might have been in the 70s, he came out of that no longer having a cat allergy. He had a cat allergy his whole life and came out of that no longer having a cat allergy. Another one that comes to mind, which is not an autoimmune condition, but Paul Stamets has told the story about doing a very, very high dose of mushrooms, and all of a sudden his stutter was no longer present. He was able to sort of get rid of his stutter as a result of that. So I think the sort of autoimmune and allergy aspect is interesting, and I'm just curious to hear your reflections on how could we better study and understand that? If we're looking at how might psychedelics be useful for an intervention as it relates to autoimmune conditions, what are the sort of questions that we need to be asking, or the hypotheses that we need to be going in with based on some of the sort of anecdotal reports that you've either experienced, read about, understand, or even maybe with an understanding of some of the mechanisms of action behind some of these autoimmune conditions?
Gosh, I probably would. I mean, you could potentially just do head-to-head comparisons between the various, immunologics or the disease modifying, anti-rheumatic drugs, prednisone, the drugs that basically just like shut down your inflammation response, and just see what happens when you take people through psychedelic therapy work, and whether it can be. And I think too that this doesn't have to be like an either or situation. It can be complementary. It can be really a complementary therapy. But if you're doing this work at the same time and getting to the root causes of whatever however the disease began to manifest, then I mean, real true science is just about asking questions and seeing what happens. And so, I mean, as long as within medicine, we of course, we have many more ethical considerations. But even right now, I'm actually collaborating with, in some ways, people, cancer is actually sort of within the umbrella of an autoimmunity in some ways.
Interesting. Okay.
And so, I mean, there's a lot of parallels between autoimmune conditions and cancer. And I'm working with local healthcare system here, the neuro-oncology group, for patients who have brain tumors, glioblastomas, that are, incurable as far as, the conventional healthcare system. And we are starting a pilot study. This would be, and you could do this in any area of medicine. It's really cool that we have the neuro-oncologists who are interested in this. But for anybody who works in sort of like endocrine or within autoimmunity. But we're doing a small pilot study, maybe 5 or 10 patients, and taking them through psilocybin therapy and doing imaging before and after the psilocybin experience to see how the therapy affects their tumor growth.
Wow.
And so you could do the same thing with people who, whatever the sort of standard measures of autoimmune markers, or various ways that autoimmune conditions present themselves as far as symptoms. You could do very rigorous scientific studies looking at how, I think, psilocybin in particular, psychedelics more generally, affect the biomarkers or affect the manifestations of the disease. Maybe we can put people into remission who previously weren't able to, at least without, these incredibly strong drugs that have significant side effects.
So the final question that I want to, we're nearing the end. We have about maybe 5-6 minutes left, but I'd love to get your sort of top of mind thoughts on is today RFK was confirmed by the financial committee in the Senate, and it goes to the full Senate, I believe, in a couple days. We're recording this podcast in early February, and it's likely he'll get approved, is what it's looking like. I'd be curious to hear some of your thoughts and reflections about maybe your hope for RFK as head of HHS, which oversees the FDA, and what that could mean for psychedelic medicine, and with the lens of access for everyone is probably not ideal for some of these really strong psychedelic compounds. I mean, I'm a big fan of it should be legal. It should be available to any consenting adult who wants to use it, but there will always have to be sort of safeguards or regulations that are around it. I'm not necessarily a fan of just decrim fully. I think it helps to have consumer protections and sort of other regulations that are part of it. But what maybe is your hope, or what are you optimistic about as it relates to what RFK could help to do for psychedelic medicine?
Well, I am really hopeful since he has been a vocal advocate and proponent for psychedelic medicines, that we can get some rescheduling of at least a few of them, at least MDMA and psilocybin, in this term. I'm really hopeful for that.
And ibogaine as well would be my hope.
And
as well.
ibogaine,
Maybe
absolutely,
ibogaine as well,
absolutely, ibogaine as well. I'm really hopeful for that. I think that the science is there to support the use, and that one thing that gives me a lot of hope too is that RFK Jr. seems to really be highlighting and giving a voice to the concern that most people have that our system has been captured by large pharmaceutical corporations and that the incentives are completely misaligned. And so, and we have this revolving door of pharma executives and in positions of power in the FDA and the CDC. Like, it makes no sense. There's so much conflict of interest there. There are a lot of people with a lot of money who are very invested in psychedelics not becoming legal. They have a huge financial, even a fiduciary responsibility to lobby against their legalization. And so I think we just have to step back and look at the system and the way that it's functioning right now, and recognize that it's not serving us. It's not serving the American people. We are sicker than ever. And I do believe that the chronic disease epidemic is the single most important, besides maybe our deficit and our interest payments that are bankrupting the country, are the status of our healthcare system, the health of our people is the second biggest existential threat. And so, he gives me, regardless of the rest, I don't, support all of his views, and everything that he says. But when it comes to his position on psychedelics, which is what I care most about, I do think that I'm very hopeful. And I do think that he has the ability to affect some pretty significant change within the next 4 years. That's my hope.
Well, and I had a conversation a few weeks ago with a guy, Brian Hubbard, who is actively supporting ibogaine. He was doing this in Kentucky. He's now working with Governor Rick Perry in Texas and was recently on the Joe Rogan podcast. We'll have Brian as a guest. We're scheduling that in. But something that Brian mentioned was, why couldn't we do for psychedelics what we did for COVID-19? And sort of Operation Warp Speed. So I think outside of the rescheduling conversation, which I am hopeful for, my hope would also be that we can remove a lot of the bureaucracy in getting these medicines approved as soon as possible. I think it's insane and ridiculous, the hundreds of millions of dollars, if not billions of dollars, that it costs to get one of these medicines approved. The length of time that's required to go through all the clinical trials when we already have the clinical evidence necessary to be able to at least reschedule these at the very least. And so my hope is that not only can we reschedule, but that maybe, we can accelerate these clinical trials so that in a year, for example, you could have veterans and first responders and maybe survivors of sexual assault, anyone who has really complex PTSD or treatment-resistant depression can get access to these medicines soon. And a lot of us were and have been concerned about the lack of progress over the last year with the rejection of MDMA in Massachusetts voting down the bill. I think it was maybe a healthy pause, because if this Operation Warp Speed is to be put into effect for something like psychedelic medicine, the biggest consideration then becomes the quality of practitioner, therapist, doctor who is providing this, the quality of support that is provided before and after, and how we ensure that that is also the highest quality. So it might not be necessarily just the drug, although I think starting with just the drug is a really good starting point. It also will be a question of how are these individuals supported before and after to mitigate some of the potential risk that comes with psychedelics.
Yes, there is a huge sort of public education campaign too that I think would be wonderful to fund. I mean, there's still so much education that needs to be, more awareness and also just overcoming a lot of the harmful narratives about these medicines and the misconceptions and of course the war on drugs, the propaganda, all of it. And so, yeah, that's a lot of where my focus is these days, actually, is on education.
Beautiful. Well, Tracy, it's been fun to be able to drop in with you. I appreciate you joining us for the Psychedelic podcast. If folks want to learn more about your work, you have a personal website, which is tracytownsendmd.com. And I imagine you also have a website for Meadow, a license. Do you want to maybe share a little bit more about where folks can find out more about Meadow or any of the other projects that you're up to? I think you also have a podcast now. Maybe you want to mention the podcast and where folks could go deeper with you there.
Yeah, I have a little podcast that's just the Tracy Townsend MD podcast. It's on all major podcasting platforms. I think if you just search my name, you should be able to find it. I also, have a practice called Meadow. You can find us at meadowmedicine.org. You can see sort of the services that we offer, what we're about, and that's for the legal psilocybin facilitation services that we offer here in Oregon.
Well, Tracy, thank you again for all of your work and for making the leap from orthopedic surgery to psilocybin facilitation. This was a really insightful and helpful interview, and I appreciate you taking the time today.
Thank you for having me.
Thanks so much for watching. For a deeper dive into the power of microdosing with complementary practice and extra guidance, check out our best-selling microdosing course. It's a science-based protocol with dozens of best practices so you can customize your protocol to your unique needs and goals. Check out the link in the description below.